So we have a question from a viewer who wants to talk about mental health issues. And this is actually a question particularly with respect to young people. We've had several questions about this over the course of the last several programs. In fact, going all the way back to the start of our program in January. Let's start with Senator Kiffmeyer. What are we likely to see? What have we seen in this session dealing with mental health issues, particularly for children?
Yeah, that can be a part of both Health and Human Services, or it could be a part of the K-12 bill as well. I've also seen it show up because it's on the minds of legislators, so it tends to come up in a variety of ways. But the big thing there is, strong families are the biggest antidote, but the challenge in the last 2 years of going through COVID, the isolation, and the wearing masks for children has just been they're not with their friends, they're not with their peers, they don't have some of the outlets and the activities. Extremely difficult for them. I think we're going to see the consequences of that when they weren't able to have in person in schools, and then they couldn't see their teachers' faces and their lips to learn speaking and language and expression, and just the outlet for some of their needs. So we are looking at programs, things that can be helpful. There's a variety of proposals. Senator Draheim has taken this one particularly to heart. They have many things. But the big thing is to look for programs that work, not just have a name, but what's their results? Do they work? And so that's been his mission. That's been our Senate mission, to find those programs that do work and then fund them and make sure that we don't just throw money at it, that we have effective outcomes for the kids and anybody
Senator
who has a
Osmek,
mental health. Go ahead.
right? Mental health issues, and also with respect to kids. Anything happening in this session? Your observations on that, Senator Osmek?
There's some work being done on the HHS area. That's Senator Abler. I know that we've been talking about that internally. We have to see what the HHS bill looks like. Remember, we did already fund this for this biennium. That's what I think people have to understand. The money we have in the surplus is, for lack of a better term, gravy. This is opportunities for us to invest, hopefully, in my opinion, single time money into programs, and in some cases maybe pilot programs to see how they work. And I know that in the HHS world, Senator Benson, Senator Utke, and Senator Abler have been working on that. So I have not as much knowledge as I do about transportation and energy, but I think we're making some progress. Hopefully we'll get the HHS bill across the finish line.
Senator Carlson, mental health issues, very quickly.
Well, it's been mentioned, and I want to echo that from what I understand, Senator Draheim's bill is magnificent. It's very good, and I think I'm not sure when that's going to come up to be for passage, but I know that the people that I know on the committees or have had exposure to it are saying that it's an excellent bill. So that would be good. Now, there's more to that entire issue, and that one of those is that we are so poorly staffed in school for counselors. And my wife taught school for 36 years. And one of the things that she knows is that there are so many kids that are so stressed out for a number of reasons. And we need to supply someone for those kids to talk to. And what we don't, I think, understand is that what these kids go through in their home life. And Senator Kiffmeyer kind of mentioned it, that, the family core is an issue. And when a family all of a sudden breaks up, the kids really go into a tailspin. Their grades suffer, their attitude suffers. They might turn to something that you'd never expect that child to take on, and it's because their family is breaking up and they're so devastated by it, and they don't have anyone to turn to. And that's where we have to have the people, and not just my wife, who was a German teacher, for kids to come to, and to be able to talk to someone and to maybe get a little bit of encouragement. And they're, because they do trust teachers, they trust people in school, and
And I'm
they
going
can
to cut you off there, Senator Carlson, because